Everybody, good morning and welcome to a weekly media briefing with Montgomery County Executive Mark Elridge, as well as our public health update. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government, and joining us today is Dr. James Bridgers, who is the Acting Health Officer, as well as Ms. Kimberly Townsend, Senior Administrator for Communicable Disease and Epidemiology from the Department of Health and Human Services, and Mr. Sean O'Donnell, who is a Program Administrator, Public Health, Emergency, Preparedness, and Response, also from the Department of Health and Human Services. Reporters, remember to use the chat during the Q&A portion of this presentation. And with that, good morning to you, Mr. County Executive.
Good morning, and thank you all for joining us today. I'm here at Strathmore in North Bethesda, where I'm going to be attending the inauguration of Montgomery College's new president, Dr. Jermaine Williams. It's a big day for Montgomery College and the county. Dr. Williams has been with us for the past 7 months, but this ceremony officially marks the beginning of his tenure at the institution. And this institution, Montgomery College has been really critical to our education, economic development, and equity efforts in the county. If we're going to create a more equitable Montgomery County, it needs to be rooted in education. And Montgomery College has found the right person to take this incredibly successful institution, already ranked 7th in the nation in best community colleges, and make it even better. Dr. Williams comes to us after leading Nassau Community College in New York, a very diverse community, not unlike our own, and he's well known in academic circles as a leader who is focused on the historically underrepresented and marginalized groups and approaches each student's education holistically. I look forward to continuing to work with Dr. Williams, and we've launched and expanded some pretty incredible programs and initiatives with Montgomery College lately. Last year, we signed an MOU with Montgomery College, the University of Maryland system, and the Universities of Shady Grove to connect students to our booming life science industry. And this new partnership is going to take us beyond already being number 2 in the nation for life sciences talent. That's one of the things that we know we have to continue to grow in the county, because as we're growing these life sciences businesses, we need to be able to provide the talent so they can hire the staff to run their companies successfully. And that's a big part of what we're doing. This summer, we launched the Ignite Hub, and that's a partnership between Montgomery College, Montgomery County Public Schools, the county government, and Apple. And that focuses on information technology. It serves as a workforce anchor and catalyst for innovation in our community. And just a few weeks ago, Used Network Systems announced plans to build a 140,000 square foot high-tech manufacturing building at the Germantown campus, giving Montgomery College students career-ready opportunities in a growth industry that we see growing every day in the county. And I'm extremely enthusiastic about our collaboration with Dr. Williams and his team to expand the reach of Montgomery College to the East County, a long overdue idea and critically important to our equity efforts. We believe the school will continue to stand out as fair and equitable place for higher education, with Dr. Williams leading the way. I'm going to take a few moments to just talk with you a little about Thrive. My view is that the council should not be taking up a decision on Thrive at this point. This is a land use plan for the next 30 years, and the council is set to vote next week. And I believe it ought to be sent back to the planning board, not just to let the new council weigh in, but to finish some of the research that never got completed during their original work on Thrive. And I want to talk a little bit about the problems with Thrive that we see already. The first is that the planning board mysteriously exempted itself from having to do an equity analysis of Thrive. So not only didn't they evaluate how they were going to reach out to the communities initially, they didn't evaluate whether the plans they created would actually create equitable outcomes or whether they would create inequitable outcomes. And the idea that we would do a plan for the next 30 years of the county that didn't evaluate what the outcomes were going to be, where people just simply said, this is what we're doing and this is what the outcome is going to be without any kind of analysis, is really problematic. And you may see more about why it's problematic as I go through this. When the council finally said they wanted an equity consultant, that person was only able, or his group was only able really to look at the community engagement aspect of this. They weren't given enough time, and they told the council they weren't given enough time to do a proper analysis, even of community engagement, but they were not given any time or money to do an evaluation of the equity of the proposals that were made themselves. They didn't actually review the zoning and the recommendations or improve to see whether they would improve or exacerbate the existing problems. A lot has been made as if this program is about affordable housing. And, you know, when they started, they were telling this is all about affordable housing. We have to do this for affordable housing. And then they did this. This next slide here, it says no concrete proposals for affordable housing. And this is their slide. And it says, yes, missing middle may be more expensive than existing homes. And it gives an example of housing being more expensive than existing homes. So for a plan where missing middle was supposed to be the missing affordable housing, their own study says it's going to be more expensive, not affordable. So they switched their story. They went from affordable housing to attainable housing. Attainable housing is like a kind of meaningless concept because all housing is attainable if you make enough money. And then in their document for Thrive, when they talked about what attainable housing was, they said attainable housing is, quote, unsubsidized market housing that is appropriate and suitable for the households that live here. Unsubsidized market housing is not affordable housing, period. The only affordable housing we build is subsidized affordable housing. And the focus on unsubsidized market housing, in their own words, tells you this program has nothing to do with affordability. And then they go further to say that attainability is being used in recognition that our housing needs need to go beyond a sole focus on affordable housing. I'm sorry, there has been no sole focus on affordable housing in Montgomery County. Montgomery County's most vaunted program, the Moderately Priced Dwelling Unit Program, or the acronym we all know, MPDUs, over a 40-year history, now has 6,700 affordable rental units for a population of 1.1 million people. Sole focus, that's not a program that has a sole focus. That's kind of like crumbs on a table. And of the 50,000, there are 50,000 households here today who are burdened with high costs. Burden means paying, more than 30%. Many of these people are spending more than 50% of their income on housing. So nowhere does Thrive talk about this. Nowhere does Thrive talk about how we solve the problem for the households who are here today. They just simply don't address it. Another thing that they've talked about has been the residential development capacity. And what they've asserted is that there's not enough housing zones for people who are going to be coming to Montgomery County. And therefore, because there's not enough housing for people, we need to do this rezoning. The only problem with that, and again, I'm using their data, not anything I came up with, countywide, Montgomery County in December of 2019, we had 382,000 units. 53,000 roughly were in municipalities and 328,000 were outside municipalities. They had an approved pipeline. A pipeline are projects that are already approved. There's nothing a developer has to do more than go and pull their building permits. They don't have to go through any approval processes now. 44,000 units already approved and in the pipeline. Almost 6,000 of them are in municipalities, and about 38,000 are outside of municipalities. So, and they've raised this issue of the number of households coming to Montgomery County by 2030. This number exceeds the number of households who are projected to come to Montgomery County by 2030. So we do not lack for zone places to build housing for people. The real issue is affordability, and we'll get to that in more detail later. But here's the other part that is really, I find stunningly disingenuous. We not only have a short-term solution, but all the projections for future growth are based on an assessment of how much of the residential development capacity will be built, in this case by 2045 or 2050. And the assumption about what's going to be built is produced by the planning board. So when they say X number of people are coming here, it's based on their evaluation of what we've already zoned for and how much of it will be built at the end of the time frame that they're using. 30 years to start with, but they have 5-year benchmarks that they expect to be built over that time period. If you look at the additional zone development in Montgomery County, this is all our master plans. We have 85, almost 86,000 more units that a developer can just come in, say, this is the master plan, I want to build this project, go through the usual approval processes. That's 85,000 more units. If you combine what's in the pipeline and what's in the residential capacity, it far exceeds the growth projection for 2045 or 2050. Far exceeds it. So this whole notion that they've been creating, that this has to be done because we don't have the housing, and if we don't do this, we will not be zoned for the people who are coming here, is just simply not true. Zoning is not the problem in Montgomery County at this point. There are jurisdictions around the country that are basically built out. Zoning may be a problem there. Zoning is not a problem here. With this development pipeline, you can see that we can actually build what it is we need. And the vast majority of all this development is near transit. And I'll point out, I was on the council, the 12 years there. And since I've been county executive, we've approved more than 22 master plans, all of which further upzone Montgomery County. So these plans were done with the idea of bringing housing closer to transit and to provide enough capacity to serve future growth in the county. So the planning board and the work that the council did created the capacity to meet our future needs. And this idea that somehow we didn't do that or it doesn't exist is just not true. And Thrive really doesn't discuss this. Almost everything we've zoned for is in the major transit corridors. And with the expansion of BRT, even more units and more activity centers are closer to transit than they were when we started this whole process, when there was no plan for bus rapid transit. So we have the housing for more than 200,000 people. We've zoned for housing, and we ought to be asking ourselves why it's not being built. What's happened that there are 35,000 units in a pipeline and the units aren't being built and people have a perception that we're not building housing? And the answer to that, Park and Planning got to in their own research. They talked to the developers in White Flint, asked them why they weren't building, and there are two major answers they got. One was that there's not enough demand for units at the prices the developers want to get for their units. So there's a mismatch between incomes of county residents who may want additional housing or want to get into new housing and the price of housing that developers would like to build in the areas that we've zoned for it. So this is a price problem. It's not an availability problem. The second part of it is that the developer cited the lack of job growth. People do not build housing and then the jobs follow housing, because you can't buy and occupy housing or rent and occupy housing unless you have a job. So if there aren't people with jobs looking for housing, you're not going to have a stimulated market for housing growth. If, on the other hand, you focus on bringing jobs here, which is what we've been working on for the last 4 years, the more jobs we bring, the more demand we create for housing. So housing growth does, to some extent, depend on what we do in the job market. But just simply zoning for housing doesn't get it done. And as the loser of many master plan votes when I was on the council, the discussion was always that I did not support jobs and housing. Well, here we are 4 years after I got off the council. The jobs and housing aren't here. People ran political campaigns complaining about the lack of jobs and housing, but they got what they wanted in terms of zoning, and it turns out that zoning was not the solution to this problem. There's a real problem in this process of several other problems I just want to mention pretty quickly. One is they added 3 new chapters to this report on economic development, environmental resilience, and racial equity and social justice. They were not part or included in what the council was originally given to vote on. There were no recommendations in these chapters, and they were never given a public hearing. So there's been no public impact and no recommendations. And council's response was there wasn't enough time. There is absolutely no hurry. There is no need for this plan to be done by the first week of November, because we do have the zone capacity for this. We've got the opportunity to do this right, and we really ought to be going back and trying to do this right. When the planning board produced maps for this plan, they used the 1964 map instead of the updated 1993 map. Our staff pointed this out to them in August 2020. They still never corrected the maps. So if a person's looking at the maps and trying to compare things, they're not comparing what is actually the map from Montgomery County today. They're comparing Thrive to 1964 maps. When you know your information is wrong, I think you're kind of obligated to correct it. And they didn't see the necessity of doing that. There are major issues, with racial justice and social justice and racial equity. There's a profound east-west divide in the county. It includes disparities in job centers, school quality, jobs, restaurant and shopping opportunities. All these issues continue to be out there. There is nothing in Thrive that addresses this. The likely result of Thrive is actually less economic integration and more gentrification in BIPOC and low-income household, in the form of low-income household displacement. And we're already seeing that in Bethesda. When they build over existing retail spaces, the housing is net new. But when they're building over existing housing, we're tending to get fewer units and we're getting more units, but fewer affordable units than we had before the development started. We should not be doing plans where a developer can go from 87 units to 400 units and provide fewer affordable units than were on the ground before they tore the buildings down. That's a major problem. The plan seems to assume that a one size fits all. It is true, it is not a zoning document, but they don't tell you is that they planned on passing the attainable housing piece right after the passage of this document. And it only got waylaid because the council chair at the time decided that they weren't going to take it up before this other project process was finished, and they weren't going to take it up in January, which is when people thought that was going to happen. And if that had been passed, we would have been looking at an overlay zone rather than a process of going master plan by master plan to see what kind of changes people need to make. And there's just not a context sensitivity to this that needs to be there. I'll say, one of the big issues that the racial equity consultants that were hired by the council touched on was the Thrive seems to assume that one size does fit all. And they noted that the plans need to have context and location sensitivity. So they also made a comment on rushing this through because the consultants felt this needed more time. And their comment, I think is pretty astute, says compressed timeframes are the enemy of equity. We are not on a path of equitable development today. Relying on conversion of houses on a one-by-one basis in residential neighborhoods isn't likely to produce much housing, period, and even less affordable housing. We need to focus actually on affordable housing. And the fact that the writers of this plan said, we had to end our sole focus on affordable housing, in my mind, gives you a rough idea of how out of touch the planning department was when they wrote this document. So I wrote the council in September. I asked them to take more time. This is a plan for the next 30 years, and I would hope people could take a breath and try to do this right. So meanwhile, back at COVID, the bivalent booster shots are showing effective results. And remember, the vaccines were approved and made available before going through human trials was typically the final step that is considered by regulators. Now that scientists are able to evaluate the additional shot in humans, they're seeing a significant boost in the immune system from the shots. And it's encouraging news as we've seen demand for the boosters finally begin to rise. And the bivalent booster is effective against both the original variants and the Omicron variant that we're dealing with now. Experts are encouraging everyone to get their flu shot and bivalent booster at the same time. I did it a day apart. It's been 2 months or more since the last vaccine shot. If it's been 2 months or more since your last vaccine shot, you can get the booster. And the recommendation comes ahead of the flu season and should be done before people are attending large family gatherings that traditionally come during the holiday season. The CDC issued a report last week noting that flu and similar illnesses are notably high next door in the District of Columbia, which is likely to be a precursor to impacting us more directly. Typically, flu season ramps up in December, so this is a little bit early. The CDC noted specific concerns about a strain called H3N2. These reports are concerning, and it's a good reason that why getting a flu shot is as important as getting the new bivalent booster. And speaking of boosters, the latest state health department numbers show that Montgomery County continues to have among the highest vaccination and booster rates, even among children 5 and up who are now eligible for their boosters. But still, there are tens of thousands of kids and adults who are eligible for the booster and they haven't gotten them. And I encourage people to please seek out vaccine options. Montgomery County continues to offer school-based clinics on a weekly basis, and we've had our third Boosterama scheduled for last Saturday at the Westfield Mall in Wheaton. I want to thank Westfield for teaming up with us again, as well as raffling off $50 gift cards to those who get boosted at that event. Our Boosterama events are a convenient and easy way to bring shots directly into the community, and we're going to be promoting these as we go on. A further note on this is, and on the boosters in general, is that we are seeing new variants, and Dr. Fauci just I guess yesterday expressed concern about some of those new variants and their ability to evade antibodies, and whether they were actually diminishing the effect of the monoclonal antibodies that some people had been receiving. And that makes getting boosted even more important, because while evading some of the body's protections may be the MO of some of the new variants, the boosters themselves provide at least a level of protection that continues to keep people from winding up in the worst situation, either severe illness or death. And anything that can knock down the number of people who get hospitalized or get severely ill or die is something we ought to be very aggressively pursuing. So I hope people will think about this and get ahead of this and make sure that they get themselves boosted. We talked a little bit about monkeypox. The cases continue to climb slowly across Maryland. There are now like 700 cases across the state. The county, we've put more shots in arms than anywhere in Maryland. We continue to be proactive using our pre-registration list to administer about 30 preventive vaccines every day. I'm proud of the efforts we're making, and I'm glad to see that the case rate here is slowing down. And having said all this, I'll turn this over to Sean O'Donnell and Kimberly Townsend for their updates on COVID and monkeypox, and then we'll take questions. Thank you all very much.
Thank you, Mr. County Executive. Okay, I should be sharing on my screen now. Taking you through, and just to expand a little bit on our county executives' points about the new tracking of variants and the new reporting of variants. It was this past week that the CDC has broken out some of the subvariants from BA5 and are reporting on them separately now. This is notably the BQ.1, BQ1.1. As we've talked about the BF7 as a subvariant. These are all related to the BA5 variant that we've seen, but they're tracking these independently because they've seen greater growth across the United States. And as we're sharing right here in our region, they're making up collectively about 17% of new cases. And it's something we want to watch. We are hopeful, because they're related to BA5, that the bivalent booster, which contains a component built off of the BA5 variant, will be effective against these. The concern is again that the previous immunity from the ancestral COVID, the original COVID that was in the original shots, may be less effective against this. That's on top of the fact that as we've stated before, the immunity wanes over time from those shots, which is again why this booster is so important. We have seen over the last few days, we've seen some increases now in our case rates slightly. They really plateaued there for about a week. And we've seen a day or two where they've gone up just a little bit. We're also starting to see some increases in our hospital cases with a COVID diagnosis. Again, this is leading us to believe that transmissions are starting to increase a little bit, much as they are with influenza, which we'll talk about in a minute. Just to expand out on that, we've seen an additional 18 COVID cases in our hospital beds, or 18 more than the previous week cases in our hospital beds at our primary hospital, and 10 more over at the alternate care site. The good news is on both fronts, both for influenza and for COVID, we are seeing people come out for those bivalent boosters. Late last week, the bivalent booster authorization was extended now all the way down to children 5 and older who are ready for a booster. And that would be anyone 5 and older who has completed their primary series of shots. And it's been at least 2 weeks since 2 months since their previous COVID shot. Again, you can get this at the same time or within without much delay within getting a flu shot if you'd like to do that. I know lots of pharmacies and other places giving shots have both the flu shot and COVID shot, will administer those back to back. So that's certainly a good idea to protect yourself that way. Looking at our, and within the county, just to go back to, within the county, we are administering now the Moderna bivalent boosters to children who are 6 and up. We've placed an order for the Pfizer bivalent boosters for that age group of 5 to 11. We're still waiting for that to come in from the manufacturer. So we will be providing these out. Anyone getting a booster now will be getting the bivalent booster. Looking at our influenza vaccinations, I know we mentioned last week about 8% of the state had gotten their annual influenza vaccination. That's already jumped to 32%. So we know people are coming out in large numbers. We hope that each week we'll see that go up significantly. I'm hopeful with the current concern about spreading these respiratory viruses that this number will be very high in our county. We just want to briefly mention, I know we've talked about COVID every week. In the past few weeks, we've talked about the influenza levels going up. But we want to mention another respiratory virus that has been tracked nationally in the state and locally for a number of years now. That's respiratory syncytial virus, or RSV, which is a little bit easier to say. This is a virus that's distinct from influenza and from COVID. It does spread quite a bit around the same months as influenza, and it has a more specific impact, specifically to very young children and to some degree, some older individuals, again, where the immune system has not yet fully developed or is not as strong as it was when you're younger. This chart showing the last several years, the solid darker blue line on the far left that's only gone for a few weeks. That's this year's data. As you can see, it's going up fairly dramatically, and it's going up earlier in the year than this has in previous years. We are also hearing from our hospital partners that their pediatric beds are becoming fuller and fuller. There's not as many pediatric beds as there are adult beds in our community, Children's Hospital, of course, is the largest source of pediatric beds, and they are all reporting a lot more pediatric cases with these sorts of symptoms. Again, this generally causes mild symptoms in individuals who have it, but we're a little bit more concerned for those who are particularly under 6 months, years of age, who might have these symptoms. Just to give a little context, this is 2 years worth of testing data. Much like COVID and other diseases, tests can range from a rapid test or a PCR test. This is data captured by the CDC from Maryland, going back to 2020, including 2020, 2021, and now in 2022. You can see the left half, which was the first year of COVID, much lower levels of this virus. As people were wearing masks, people were not going out nearly as much. And then last year, as people started to go out more, you can see a larger number of cases across Maryland. And then again, where we are right now, you can see that the red line is test positivity. So our test positivity is very high right now, again, indicating that there's a lot of transmissions of this. So we just want to share this, that make an awareness. Parents with very young children, particularly children who might have other underlying health concerns, if they were a premature birth, or if they have chronic lung disease or other congenital heart diseases or weakened immune systems. We just ask that parents are aware if they see some of these symptoms, and they do look like flu-like symptoms, cold-like symptoms, COVID-like symptoms, please consult with your pediatrician, your primary care provider, just to make sure that we're not overlooking this disease. Now I'd like to turn it over to my colleague, Ms. Kimberly Townsend, to talk to you about where we are with monkeypox.
Thank you, Sean. So as you can see here, we're just above 27,000 cases of Mpox nationwide. In the state of Maryland, we have 692 cases, which is 11 cases more than we have since our update. So as mentioned earlier, we're still seeing transmission, we're still seeing positive cases, but at a much slower rate. And you can see here with our 7-day average, there continues to be a downward trend of new cases reported to CDC. In Montgomery County, we have 83 cases, and I would like to note that this is the same number of cases we reported at our last update, so we've had no new cases in the past week. We've provided vaccine to just over 2,300 residents, which accounts for about 30% of the vaccine here in the state of Maryland. So we continue to provide vaccination to those that are eligible for post-exposure and pre-exposure prophylaxis. We continue to monitor our cases so that we can keep everyone updated. We continue to encourage everyone, if they think they're eligible to receive MPX vaccination, to please go to our website and enter your information into our pre-registration tool. And with that, I would like to turn it back over to Lorna.
Thank you, everybody. Members of the media, this is the portion of the presentation for the Q&A. Do you use the chat, and please mention the name of the organization you represent. Mr. County Executive, we do know that you have a hard stop of 12:15 because you need to participate in this event at the Strathmore. And Katie Shaver, you're with the Washington Post, correct? You have a question, I believe.
Hi, yes, sorry about that. Mr. Elridge, you said that the county needs to attract more jobs to spur the housing market. How do you propose to do that when Thrive says a big problem is that the job growth in the county has been relatively sluggish and has mostly been in lower wage sectors?
Mr. County Executive, please unmute.
Sorry about that. I mean, I think that's part of the problem. I can't alter reality. You know, the job slump in the county, the flattening of the jobs began over a decade ago. And, you know, we never fully came out of the recession last time, and things did remain relatively flat, and the wages of a lot of the jobs are less than what builders want for what the property they want to develop. That's a serious mismatch. So obviously, you know, some of the work we do, and we talk about Montgomery College, is trying to upskill our workforce as much as possible. We've done a lot of work with WorkSource Montgomery, which was not doing what we had hoped they would do for, you know, any number of years, and to really get them to put an additional focus on job training, not just for people at minimum wage jobs, but to help train people up and skill them up for higher paid jobs. And we've obviously been pretty active in trying to attract, you know, what our great asset in this county is bio, you know, so we've got record amount of lab space under construction. We, you know, continue to have companies coming here and growing here. We've been very aggressive in supporting that kind of growth in the county, and we're going to continue to do that because we know this absolutely has to happen, but it's not, you can't just turn it on any more than you could just simply turn it off. I mean, you need to create a climate where people increasingly want to be here. And that was one of my criticisms of just focusing on zoning all those years, was you could zone anything you want, but nobody's going to build anything until there's demand for the product. So zoning for office and having people actually build office buildings and attract tenants are two very, very different things. So we focused on trying to develop and expand our base here in the county. So that's the job we have to do. But short of that, I mean, I'm not sure where you go with your question. I mean, those two things being reality, you're not going to certainly solve an affordable housing problem if people want to build and are zoned for high-rise buildings and it costs them $500 or $600 a square foot to build a unit. You're not going to get a solution to affordable housing that way. We only require between 12.5% and 15% of any new development to be affordable. And I'll point two things out about that. If the county had 10,000 new housing units built, it would only yield between 1,300 and 1,500 affordable units. You stack that up against either the projections for who's coming here or for the people who can't afford housing who live here today, you don't even come close to addressing those numbers. And then if you dig deeper into the affordability issue, you know, these are all county policies. If you wanted to increase affordable housing, you would require more affordable units to be built. We don't do that. You know, that's one of the things we're going to be proposing, is increasing the range of affordability. The MPDU program not only hasn't produced a lot of units, but what they do produce serves people earning between basically 60 and 75% of area median income. So sort of $60,000 to $75,000 for rounding purposes. So it doesn't serve people earning less than that unless the county steps up and provides additional subsidies to the nonprofits we work with or to the developers we work with. And it doesn't serve people who say earn $80,000. We hear this a lot from young folks. At $80,000, you can't get into an MPDU, but you also can't find market affordable housing in the new buildings in Bethesda, for example. So fixing this is more complex than just saying this is a zoning problem. And the last thing I'll say, you know, Thrive depends on people voluntarily selling their homes and converting those homes into duplexes and triplexes. If you wanted a slow boat to China, you know, use a voluntary program where nobody has to do anything. And oh, by the way, there's no affordability requirement for any of those units that would be built to duplex or triplex. Even when the planning board was thinking about attainable housing and they were going to allow 15-unit buildings in the neighborhoods, 15 units is an interesting number because it's below the number that requires MPDUs to be built. So our problem is complex, and this is like hitting a complex problem and thinking you're going to solve it by hitting one nail on the head, as opposed to dealing with the multitude of nails we have to deal with if we're going to fix this. Does that help?
Yes, and just one follow-up question. Are you saying that your administration has done all you can to attract more jobs to the county, or do you think there's more that still could be done?
Oh, I think there's more that can be done. You know, we've talked with the EDC. You got to remember, you know, the EDC is this quasi-independent group, and we've talked with them about how do we extend our outreach, how do we do a better job of telling a story about why people should come to Montgomery County. You know, we're successful in the area of life sciences. We don't do, frankly, as well outside of life sciences, and that's part of the challenge. Is how is Montgomery County marketed, and how do people see us? We've got a planning process that takes longer here than any place else, and a lot of that has to do with park and planning. We have some recommendations we'll be bringing forward to deal with that. The process in Montgomery County is unique in the state of Maryland and possibly doesn't exist anyplace else in the United States. We think we can fix that, and I've proposed dealing with the impact taxes, which sit at the front of developments, and moving to a process more like Virginia's process, where they use taxing districts rather than impact taxes, because the districts don't impact the price of new construction the way the impact taxes do. So we've got suggestions, and hopefully if somebody's eating your lunch, you're supposed to look at how they got your lunch. And we've spent a lot of time looking at what competition does around here and what we do. And I see lots of opportunities for us to make ourselves more competitive. And that's what we intend to propose.
Thank you.
Thank you, Katie. I do not see any other questions on the chat from members of the media. We'll give you guys a second or two. Oh, I see that Jilly Haynes has her hand up from Bethesda Beat. Jeannie, good afternoon. Still good morning. No? Okay. It was actually my hand on her little box there. But we do have Kate Ryan from TOP. Good morning, Kate.
Kate,
Hey,
you never disappoint.
I don't know about that. Thank you. I do have a question on housing, and you said, you know, our planning process is one of the unique ones in the state. Another unique feature about Montgomery County is the agricultural reserve. Do you ever see having to break that down to provide more space for more housing that could be more affordable? Would that ever change? And going back to Katie's questions on jobs, this has been longstanding prior to your administration. Is Montgomery County not capable of tackling this problem?
Wow. So, I mean, I may ask you to repeat this up because I'm going to want to unpack it.
Sure.
Maybe starting at the jobs end. You know, after the recession, a lot of people flattened out. Montgomery County, when things got less flat, we still had, you know, kind of the same systems in place. But I will say one thing that Northern Virginia did is build lots of transportation. And there's a reason, you know, I proposed building a bus rapid transit network like 14 years ago, maybe 15 years ago. And the whole point of it when I proposed it was to provide a transportation network that could help people get from their homes to work and make us competitive. You know, the Red Line runs in and out of Montgomery County. Mostly, you know, it was designed to ferry people from Montgomery County into the district for jobs in the district. It wasn't designed as a system to serve Montgomery County's growth over a period of years. If we had, we would have, you know, you would have had more lines, and you would have had east-west connections in addition to these two north, you know, the two north-south aspects of the Red Line. We didn't do that. And Virginia went all in terms of providing transit, not just the Silver Line, but, you know, every Virginia county now has bus rapid transit that's actually up and functioning. Because of the way we tax, we were not ever able to put enough money into building these systems. And I can't blame Mike or anybody else. As long as you are saddled with the way we tax, you don't have the ability to raise capital, and you don't create an ongoing stream of capital that lets you float bonds to build projects. Virginia went to a different system of taxation that produced a steady stream of revenues against which they could bond and they could build projects. In addition, the state played a much bigger role in Virginia in terms of providing transportation support compared to the state of Maryland. I mean, how long did people fuss over whether they would do the Purple Line? And then how long has it taken to get any money? We got our first money from the state this year to do part of a BRT line, not even a significant investment, but the beginning of an investment. So we've not acted on things we know are major drivers of business location. The Post, of all journalistic endeavors, did an article before the last election about business leaders cited the lack of an adequate bus system, not just in Montgomery County, but regionally, as a major impediment to economic growth. It's kind of why I proposed the BRT in the first place, because I understood we had a major impediment. Our inability to address that is the reason why, Tyson's puts in the Silver Line. You got BRT in every county over there, and we don't have any of that stuff. So you want to be competitive, you've got to do things that make you competitive. And we just flat out haven't done it. I think, if you were talking about a place that people want to be, the reason we're competitive is people look at schools and recreation and quality of life issues in Montgomery County, and I'll stack us up against anybody there. But in terms of transportation, we would not win that competition. And in terms of a development process that works in a way that's smooth, that can still take in citizen input at the same time, develop a product quicker than we've been doing historically, that's something we can fix. And like I said, something I intend to address. So is that everything you asked, or is that?
Going back to housing and affordable housing, you're saying that developers aren't building because they can't charge what they want to. And you cited Bethesda, but what about up county? And again, all that land in the ag reserve, do you ever, I know that there are people who worry about that. What is that?
I worry about, so I'll just say that, the projections for growth in Montgomery County come from park and planning. And the projections for growth are based on the zoning that we've done. So, I think you've been around, you've heard of the round forecasts, I think we're in round 9.2. And when they do these round forecasts, this is true for the entire DC region, every planning department looks at what they've zoned, and then they make projections on 5-year intervals over how much they think will be built of the zone capacity. So when someone says, when the planning board says, we believe 200,000 people, which translates to something less than 80,000 units, are going to come here by 2050, that's all based on how much of the existing zoning they think will be built. So my answer to you is that through 2050, we've got more than enough housing to accommodate this. Even at that, there will be opportunities to probably increase density in some areas. I mean, Silver Springs numbers from the last master plan weren't even in that estimate. They weren't part of the forecast at that point. So the number would be even higher if you did it today. So I'm not terribly vexed about whether we'll be able to build the housing over the next 30 or 40 years in terms of finding places to build it. I am concerned that given the economic mismatch between wages and what people expect to be able to sell housing for, rent housing for, that could continue to be a problem. That's why we're going to recommend like more MPDUs at a broader range of affordability, not just 60 to 70% or 75%, but raising the upper limit and raising the lower limit, as well as increasing the number of units we have to yield. I mean, people have to get real about this. If you only require 15% of market units to be affordable, please tell me how the math gets you to the number of units we have to have, because it doesn't get you there. So you need policies that match your math.
And then I know that the choice for selecting the next planning board will be up to the council. They're the ones who can appoint and remove. Do you have candidates that you want to see on that planning board? Do you think there needs to be a totally different outlook? What do you think is needed?
Wow. I'm not putting forward any candidates. I've talked to a number of people, and I mean, there are more than 3 people who I think would be good planning board members. And, if I was looking for planning board members, I would look for people who were not known for being vociferously in favor of one side or the other side of this debate. I mean, for one thing, it's an ill-informed debate when people don't really understand what the nature of our zoning is and what growth policies mean. But I prefer people who have more civic activism and have involvement in the different and diverse communities around the county. You've got professional planning staff that could play a role in this. I mean, that should play a role in how plans are done. I'll point out that Gwen Wright actually said, when she was talking about how Thrive was done, that after the staff draft went out for public comment, the chair went back and wrote the plan himself with one other staff member. That's never been done in the county before. When we did the earlier, general plan drafts and revisions, they were done by citizen committees. People talked about it. They sat around tables. I once sat on the sector plan committee for Silver Spring. People were brought in to sit on these committees with diverse points of view. And they worked with each other and worked with staff to prevent a draft that then was presented to the planning board. It was never top down. This is the most top down thing we've ever done. And I think that's one reason there's so much resistance, is that it is top down. It doesn't come out of communities organically. If people aren't going to win a battle, they at least need to feel like they were heard. And I can tell you, when I was on the sector plan committee, I didn't get everything I wanted, but nobody got everything we wanted. You all worked together to put together a plan that we could all stand behind, and I still think that can be done. So I think, you should absolutely have a sense of that person sitting there. They've got a sense of balance in what they're going to do. And they don't need to take hard positions on the particulars of Thrive or attainable housing, but they ought to be able to think about it, and they ought to engage communities, which would be a novel thought, to talk to them about, how would this look like? Some of the stuff, when I hear people who oppose Thrive, this fear of they're going to be bombarded by, low-income residents, that's not going to happen. The most likely thing is property values could go up as easily as they could go down, because if you're building in a neighborhood of $1 million houses and somebody says you can build 3 townhouses on that lot, a developer is not going to build 3 $400,000 townhouses. They'll be building $300,000, $1 million townhouses with elevators going to the 3rd story. So I think some of the fears aren't justified, but absent having real discussions with communities, which is why this thing does not need to be rushed through. You might get more agreement about what can be done and how things could be done if people were genuinely engaged, instead of engagement consisting of 2 minutes on a Zoom conversation. That's not engagement.
I do have a question for the health aspect here for either Dr. Bridgers or Sean O'Donnell on RSV versus, I know there's been a lot of talk about, and forgive me, I'm not well informed in this area, avian flu. What is the situation with avian flu? I know that wildlife experts are taking a hard look at this. Is this something we need to be very worried about, or it's not that much of a concern right now? Where are we on that?
So good morning, Katie, and great question. So we've been monitoring it, avian flu transmission, along with the Maryland Department of Health. The Maryland Department of the Environment also sent a health officer notice, and our public health emergency and response managers also received a note. Avian flu is mostly transmitted in those areas where we see more poultry producing capabilities and capacity. We've monitored in the past, especially when we've had county fairs. And so we continue to monitor any flu-like illnesses. We will see those transmissions in poultry and livestock. In the fair, we've gone beyond that. We will continue to monitor it in the county and work with the Maryland Department of Health and their zoonotic team at the state. But it's always a concern. The question that you didn't ask about was the Ebola virus. And so we continue to monitor that internationally and nationally. We've seen that in the past, and we've kept our county executive up to date on all of the outbreaks in the state, and we continue to monitor it. So any communicable disease, any virus that's transmitted in the community is always a concern. And what we typically do and traditionally do is put out a public information notice regarding those viruses. So it is something to watch. It is not something to be alarmed about now, but we will continue to monitor and watch it as we do with all our communicable diseases under Ms. Townsend's shop.
Got it. And then lastly, because I missed the top of this and I apologize. I know there's been a reference at the council to health officer appointment. Where are we on the health officer appointment? And pardon me, Dr. Bridgers, but it's a question that comes up.
It's going to happen. We've gotten through the state. Is it safe to say she's accepted the offer, Dr. Bridgers?
I would say it's being considered. We're almost there. It will go before the council with the recommendation, Mr. County Executive. So we're almost there, Kate, but we're looking at the best way forward. The County Executive and his team have put together a robust response. And as the County Executive said, we've gone over or gotten through most of the hurdles. So we're almost there.
Thank you very much.
Thank you, Kate. Members of the media, I do not see any more requests for questions on the chat. We'll give you a second or two since I know one of you just joined us. All righty, going once, going twice. Thank you, everybody, for joining us today. Have a great afternoon. Stay safe, and we'll see you again next time. Thank you.